I'll invite you to take some nice, slow, deep breaths. Notice where the breath is moving through the body and where it feels restricted. Just checking to see if the belly can rise and fall with each breath. And can you stretch the ribs a little bit more with the inhale and a feeling of lifting the chest, pointing those collarbones toward the sky. Just for a couple of breaths, you don't want to get dizzy. Really capturing that inhale as it brings your breath to the whole body. And then even though you can't feel it coming all the way to your head, just in your mind's eye, picture the breath opening your head. Filling the mind, opening the crown, giving you a little lift in your spine. And then switching your intention to focus on the exhale, as though you've invited the energy from above your head to bring in some fresh, healing light. A little bit of vitality to come into the mind and wake up the areas of creativity. Breaking up any stagnation that creates limiting beliefs. And then feeling that light moving down from the top of the spine to the bottom of the spine. And you can go as fast or as slowly as that takes. And that alone can be a meditation on its own. So you start with the head and then you realize, okay, wait, we've got the top of the spine comes out from the back of the head. And then you picture the light moving through the cervical spine. There's 7 of those. And every time you feel the sensation of dropping into another vertebral segment or another spinal segment, it's almost like you're puffing up the disc in between each one with your intention. You're letting some light flow through, and you're freeing up the nerves on either side of the spinal segment. And that then helps the different organs. So when you move through the first 3 cervical vertebrae, you're actually breathing vitality into your eyes, your nose, your ears. And then feeling that light down through the mid-cervicals, opening up the throat and the mouth, to the lower cervicals, helping your head, your thyroid, feeling that drop down into the thoracics where your shoulders begin, and noticing things slow down a little bit here. There are 12. So you can take these in groups of 3 if you want, the top 3. Giving a little gift to your breath, the middle 3. Feeling the nerve energy through the heart, through that rib cage, even the thymus gland for your immune system that's under the breastbone. And then 7, 8, 9, kind of around the, under the breast tissue, into the stomach. And then where the ribs kind of come to an end, 10, 11, 12, just around the navel. Engaging with the liver on the right, opening up the flow through the spleen on the left. And then the top of the lumbar, you're bringing light through that band there to your kidneys, through the spine to the bottom of the lumbar to the sacrum, around your waist, into the organs in the pelvic floor. And then it's almost like you could feel the light in the tailbone. And then you might be able to project that light down to the earth. If you want, it can go through the feet or not. But at least feel a tugging at your tailbone and a connection down, down, down to the earth. And we're doing a descending to help with grounding. If people are, you're feeling a little down, or you're needing inspiration, you would start with your tailbone or your feet and move up. But you don't want to really do that if you're feeling anxious or restless. You want to do more of a grounding top to bottom. So now your spine is open. And you can take a few more passes if you need to on areas that feel like they're not quite open. Or you can begin to move through into your earth center and inviting the earth tissue, which is the muscles, to soften in the body and relax. After any kind of a procedure, the muscles around where you had your procedure have a strong reaction. They are happy to have been affected by this procedure, but there's a reaction to that. And bringing your awareness to the earth energy, to sending love, you could put your hands on it, sending that healing light. Thank you, muscles, for helping me by taking this experience. I know it's hard to strengthen again. I'm so grateful for you to help me. This earth energy has an emotion of worry. So it's just so comforting the earth energy of your muscles to say, we're okay. We're going to be fine. It's going to take some work and some patience and some very focused intention, but we're going to get stronger than we've ever been before. And as you work on this area that you've had an injury or this procedure in, you may begin to feel your body begin to move on its own as it unwinds and releases trauma from your tissues. That's a really healthy, wonderful thing to let happen. And it may start to spread to other parts, so like in your hip, it may then start to include your leg, your low back, your pelvis. And allow an energy of warm, healing light. It's almost like someone's pouring into your tissues this mineral-rich, full of vitality syrup of energy that's almost like the texture of aloe vera pouring through and soaking those muscles, allowing them to be healed and mended. And feeling the tissues release and let go of trauma by spontaneously moving. And you ask yourself the question, if you have what's called an energy cyst, where the tissues are going in a little whirlpool, and they keep doing that, the craniosacral somato-emotional release technique would be to give it a little energy to invite it to find its exit. So let's say you're feeling a swirling of energy. It might even begin to cause discomfort. Ask it where it wants to go out. Sometimes it goes out, like if it's the hip, you go out the foot. It might go out up and down the spine, or it might want you to exhale it. Allow those tissues to show you their way to release the trauma. And chances are after that's happened, you'll feel a release. And you can do that in, more and more places. It doesn't have to be just one location. And my experience says it's actually, once that releases, some other part will show you where it needs to go. And you don't have to follow up right now on every one of those. You can do one and say, hey, I'll be back. But you can follow the trauma release as your body's wisdom shows you the next place. It might even be like the knee or the foot, like it may have nothing to do with where you were. But the trauma of a procedure is a real experience that your tissues have gone through beyond what your mind is thinking or your heart is thinking emotionally. it can have some grief. And so it's always good to just place your hands there if you can, and tell it, I'm so sorry that you had to go through this for the greater good, so to speak. I'm so grateful. Thank you. And sometimes that'll bring up tears, and pain can cause grief. And relief from pain can help us realize what we've been through. And emptying those well of emotions, or emptying those emotions from the well of feelings, brings flow of energy and healing. And with procedures in joints, we want to make sure to touch base on the wood energy. There are acupuncture meridians that go through the legs into the torso. And there are acupuncture meridians that go from the hands to the torso. There's 6 on each limb. And so a little flow therapy here, it's an inner alchemy or inner qigong that you're going to be doing, can be supportive as well. Taking your time, asking your body, do my meridians want to flow from my belly out toward my foot or hand, or do my meridians want to draw energy up from the end of the extremity into the torso? So the first question you ask your body is, if you can, and if you don't get any information, just make it up. But if you do get a sense of it, say it wants to start in your belly and move through the hip down to the foot. Then feel the belly and notice, think about how dynamic the hip is. So those meridians are going to go through the gluteus muscles in the buttock and down into the back of the leg. And then others are actually going to go from the belly down the front of the leg. So we have the bladder meridian that technically flows from the top of the body down to the foot. And that goes from through the base of the spine, the sacrum, down the back of the leg to the outer ankle. So let's just flow through the bladder meridian. And it can take seconds and it can take minutes. You make this your meditation. So sacrum through the back, through the buttock, down through the back of the knee. And then the side, outer side of the leg, ankle to the pinky toe. And if you feel that good energy, you could, if you wanted, to start now on the inner water channel, which is your kidney channel. So you could move over now to the base, the ball of the foot, bladder 1, bubbling spring. And you could then start breathing up the inside of the ankle, up to the inside of the knee, up into the groin, and you're then going to be increasing the flow through the inside of the hip, like through the psoas muscle into the lower belly. And then if you like, we can go back down the outer side again, gallbladder. That goes through the outside of the hip, down the iliotibial band, which is the band from the hip to the knee. Flowing on your exhale down to the outer ankle, front of the ankle, to the second toe from the pinky. And then we go up the liver channels. We're going from between the great toe and the second toe up the inside of the leg, breathing up on inhale to the knee, to the groin, to kind of the front groin part. And then we're going to go down the stomach yang channel. And this is going to head toward the shin and the middle toes. So you're feeling kind of the front of the hip now, down through the front of the knee, but on the outer side, down the shin, allowing that flow to the middle toes. And then you're going to do the earth yin spleen channel from the middle, from the great toe to the ankle as well, and then up the inside of the leg. It sits just in front of that liver channel. So it comes all the way up to the knee. It goes all the way up the groin again into the psoas as well. They sort of go up like a T. And then once you feel the energy flowing up and down through your limb, you just want to invite that energy to flow into the entirety of your body, and maybe invite the other limb as well. So taking a breath from both feet up to the hips, feeling it swirling around the pelvic floor, and feel it moving up into the belly. The energy is rising to the chest and the upper back, all the way up, down the arms to the fingers. And then from the fingers back to the chest, down through the pelvic region, flowing down through both hips to both feet. And then that can be kind of tiring. So it's a lot of work, inner Qigong and this kind of meditation. And so we're going to just allow you now to rest and have you go into the peaceful water element as you allow your body to experience this new flow, this new healing, and this deep relaxation through the body and the body's tissue memory. Allowing that water energy to take you somewhere beautiful where you're floating on the water, or you're buoyantly floating without any effort, like a warm bay. Or if it feels a little insecure to do that, maybe you're just near the water. And inviting the water element to rock you back and forth like you're a piece of seaweed. And the warm fire energy of the sun is warm on your body. And now it's time to reap the benefits of all the work you just did with a deep rest. Allowing and inviting the element of water to hold you, to fill your well of reserves, to bring you courage and strength, especially through your mind, the marrow of your bones, and the hormonal system in your body, all water element. May I be at peace. May I continue to feel safe. May I surrender to the universe, be held in light and love, and remember my connection to all there is.